Hello, I am Phil, your sonographer today.
Stenographer? So you will take notes during a trial?
No, I don't think those are even a thing anymore. I am your sonographer.
Stenographer?
Sonographer?
I don't understand.
One thing people should know about becoming a sonographer is that everyone will think you are telling them you are a stenographer.
Hello. I would like to become a sonographer because it looks easy and I think babies are cute.
It's important for people to know that in order to become a sonographer, you must complete coursework at an accredited ultrasound program. Do you have any background in the medical field?
I have no experience in anything. I saw that Doritos commercial with the ultrasound during the Super Bowl though. Boy, was that funny.
You will need prerequisites in order to start most programs. Have you ever taken a physics or anatomy class?
No.
You also will need to choose if you'd like to pursue a BS or certificate in ultrasound. There are also both online and in-person programs. Do you think you would like an online or in-person format?
I am online much of the day looking at pictures of cats and funny videos of people falling. I think I will choose online.
I chose online due to the flexibility it gave me to work while in school as well as the independence to learn at my own pace.
Yes. That too. I think I am ready to become a sonographer. Thank you.
So before you venture into the world of sonography, you want to do your research. You want to know, what exactly does a sonographer do? What are the daily activities of a sonographer? What do they do? So that's something you really want to look into and find out if it's for you. There's different kinds of sonography. There's cardiac, there's general, and there's vascular. Those are the three main types of sonography. So you want to figure out which track is best suited for you. So you want to look up what each of those different technicians look for. What do they do? What parts of the body they're concentrating on? That type of stuff. What is a typical work setting like? Where do sonographers usually work? Of course, we know they work in hospitals, but what other places are they found? So you want to look that up and figure out which type of work setting that you would be shooting for working in, or if it's okay for you to work in any of the work settings. So you want to know where you're going to be working. I believe that's important to know. You also want to know what the patient population is and what kind of pathology and symptoms you'll expect to see. So you want to know if you're going to be dealing with bedridden patients, infants, toddlers, children, teenagers, nursing home. What kind of population are you going to be dealing with, and what are going to be their main symptoms? They might be in ICU, they might be hooked on ventilators, they might have swollen limbs. Which kind of patient are you going to be prone to servicing? So depending on your track, you may deal with one particular type of patient more than the other, and you might see one particular symptom or pathology more than the other, but it's good to know what exactly you'll expect to see, so you'll know if that's something that you can handle or deal with on a regular basis. And also, another important thing you want to research is the career outlook for sonographers. You don't want to invest a lot of time and studies into a career that doesn't have a great outlook for you, or that does not ensure a great future for you. So look into it, see what area has the best outlook for sonographers. If you're thinking of relocating, you might want to possibly look up the state or the city where you're interested in relocating and figuring out what the salary range is and the career outlook is in that area for sonographers. So you want to make sure it's worthwhile the time that you'll be investing. Some good websites to check out are ardms.org, which is the American Registry for Diagnostic Medical Sonography, SDMS, Society for Diagnostic Medical Sonography, and svunet.org, which is the Society for Vascular Ultrasound. Those are just a couple of ultrasound websites that you can check out that will give you career outlook, salary information, and also they'll give you information on what you need to become a sonographer, where you can get trained, and also after you have received your training, how you can acquire continuing education credits and things like that via seminars or other avenues. But those are good websites, formal websites to go to. Some other websites are salary.com, indeed.com. They also give salary information based on your geographical area and things like that. And also the Department of Labor also gives some information on career outlook and salary information for the different types of employment. One of the more important things you need to know about being a sonographer is knowing your anatomy. Prerequisites for the program include anatomy and physiology and biology. So these are important foundation courses for you to be successful in the program, because you're going to get anatomy based on your individual concentration, whether it's general ultrasound, vascular anatomy, or cardiac anatomy. But you need to have that foundation and know the basics. So you need to know the medical terminology, the orientation, whether it's anterior, lateral, posterior, inferior, those things like that. You need to have that basic understanding. So you need to know what structures and organs that you're going to be interrogating based on your concentration. Again, so cardiac, of course, is going to deal with the heart. Vascular is going to deal with the vessels, the peripheral vessels, and general is going to deal with the visceral organs, etc. So you also need to know where these structures are, where they're located in the body, what they're next to, what they're in relation to, and things of that sort. You want to know how these organs and structures, how they function. What is their physiological function? What are they supposed to be doing? And what's abnormal? Because that's what you're going to have to recognize when you're scanning. So you'll learn more of that in your anatomy. Again, that's related to your particular track. But again, it's important to have a basic understanding of how things work in the body and what their functions should be. So if you have old textbooks, it's good to keep those on hand because they'll be helpful in case you run into problems. And you can also check out YouTube and Healthline.com, which offer various tutorials and animations regarding anatomy and physiology. So part of being a sonographer or being a good sonographer is having great bedside manner. We've all been patients at one point in our lives, and I can attest to how good bedside manner has made the difference between having a wonderful experience or a dreadfully bad experience at a medical facility. So you want to make sure you're that great sonographer who makes the patient feel comfortable and ensures that they have a positive experience during their visit or their study. Patients are more satisfied with their visits when you have good bedside manner, and they're more likely to share details, personal details with you that may aid in their diagnosis. They might share something about the activity that they was doing when their injury occurred, which may help you when you're inseminating their body and trying to take a look at the things that are going on with them. It also may help the doctor figure out, what's going on with them and aid in the diagnosis as well. So it's good to have that rapport with the patient and gain their trust so that they're comfortable with you. And that all ties into empathy. Empathy has been defined as the capacity to share and understand another's state of mind or emotion, a communication skill that uses active listening and deep understanding. So when the patient is talking and telling you what's going on, you want to make sure you're listening and grasping those details to document. That'll help you. And you want to also let them know that you're listening, so you want to actively engage in the conversation. Let them know that you understand what they're saying. Repeat some things back to them so they know that you're really listening. And just empathize with them. They might be feeling afraid. Just reassure them that everything is going to be okay. You're going to take the best care of them while they're in your care at that time. And even after their care, you want to let them know what's going to happen. The doctor's going to review the study. You'll have your report in this amount of days. If you don't hear anything back, you can contact this person. Those are the type of things that you want to present to the patient. You want to explain the procedure, explain what's going on as you're doing it, let the patient know what's going to happen. If you want them to participate, what's expected of them. You want to build that confidence with the patient so they're confident in your skills. And you also want to ensure that they're comfortable. If they have to undress, you want to give them that privacy, cover them up, close the door, close the curtain. Make that patient feel that their best interest is your concern. Again, you want to listen to the patient. If they have any questions, you want to answer the questions to the best of your ability. If you can't answer the question, you can ask a nurse or a physician. Just let the patient know that you're striving to give them a great experience. And that's part of being a good sonographer. That will be one of your duties. So you want to make sure that you're capable of doing that. You're willing to do that. You have no problem doing that because that will be required of you as a sonographer or healthcare provider.